Menstruation is a woman's monthly bleeding, sometimes known as her period. Periods are caused by the fluctuations in the body's hormones level. Hormones act as messengers in the chemical world. The ovaries release estrogen and progesterone. These hormones contribute to the formations of the uterine lining or womb. The developed lining is now ready for a fertilized egg to adhere to and begin development. If no fertilized egg is present, the lining deteriorates and bleeds. After then, the whole procedure is repeated. The menstrual cycle is 28 days long on average. The cycle begins on the first day of one period and concludes on the first day of the next. On day 14, the average woman ovulates. Some women experience slight discomfort in their lower abdomen, spotting or bleeding at this time, while others have no symptoms at all. And some of the syndromes during the menstruations are dysmenorrhea or menstrual cramps, amenorrhea or absence of menstruations, and oligomenorrhea or intermittent cycles. If a woman has intercourse a few days before and during ovulations, she is more likely to become pregnant. A woman's menstrual cycle is divided into 4 phases, known as menstruation phase, follicular phase, ovulation phase, and luteal phase. The menstrual phase begins on the first day of menstruations and lasts till the 5th day. The following events occur during this phase. The uterus sheds its inner lining of soft tissue and blood vessels which exits the body from the vagina in form of menstrual fluid. Then a blood loss of 10 ml to 80 ml. In this phase, you may experience abdominal cramps caused by the contractions of the uterine and the abdominal muscles to expel the menstrual fluid. Then, in the follicular phase, it begins on the first day of menstruations, but it lasts until the 13th day of the menstrual cycle. The following events occur during this phase. The pituitary gland secretes a hormone that stimulates the egg cells in the ovaries to grow. One of these egg cells begins to mature in a sac-like structure called a follicle, which takes 13th day for the egg cell to reach maturity. While the ovulation phase happens on the 14th day of the cycle. The pituitary gland secretes a hormone that causes the ovary to release the matured egg cell. The released egg cell is swept into the fallopian tube by the cilia of the fimbriae. Fimbriae are finger-like projections located at the end of the fallopian tube close to the ovaries, and cilia are slender hair-like projections on each fimbria. And lastly, the luteal phase, which begins on the 15th day and lasts till the end of the cycle. The following events occur during this phase. The egg cell released during ovulation stays in the fallopian tube for 24 hours. If a sperm cell does not impregnate the egg cell within that time, the egg cell disintegrates, and the hormones that causes the uterus to retain its endometrium gets used up by the end of the menstrual cycle. This causes the menstrual phase of the next cycle to begin. Periods are natural, healthy part of a girl's life. They shouldn't get in the way of exercising, having fun, and enjoying life. If you feel embarrassed, ask for help from others, like your doctor, parent, healthcare, teacher, school nurse, or older sister. Just embrace it, because this phenomenon happens to all women, and it's natural.